The next portion of track 2, which is harnessing emerging technology and models for healthcare insights. And a very exciting topic to take us right after lunch here, which is dealing with the day in the life, a day in the life of the patient journey. Very exciting topic. And to bring us this information today are two extremely qualified individuals from Ipsos. We have with us today Shannon Childs and also Emily Sobol. And very excited to be able to introduce them. And essentially, Shannon has shared with us that she has been a quant researcher and specialist for over 20 years. And in addition, Emily is a veteran of social data. So please welcome Shannon and Emily.
So thanks for, can you hear me? I'm good? Good, good. I have a loud voice anyway. Thanks for coming to listen to us. We only have 15 minutes, right? So it's sort of that freak out mode of what can we really convey in 15 minutes. So we're going to do our best, try not to talk too quickly. Please come talk to us afterwards if you want more detail, and we'll certainly get into it. So I'm going to move pretty quickly. So hello, here we are. I'm part of our Ipsos division called SMX, which stands for the Social Media Exchange. So I oversee all of our execution in North America and consult globally when it comes to social intelligence. And I'll let Shannon will jump on in just a moment here. So you certainly don't need me to tell you this, but just to kind of level set, we of course know that social media and mobile technology and mobile enable people to talk like they never did before, right? Now the data sources are expanding daily. We're constantly adding more and more data, which is amazing. But what I loved about hearing some of the earlier conversations, this happened this morning, it's also incredibly difficult to deal with all of this data and how do we make sense of it. So we can harness all of that data, and that's great, but how do we actually get down to the smart data, and I love that term that came out of the morning session, to make sure that we're truly pulling out some good insights and not just getting lost in all the data that exists. So again, this is probably all data you've seen before, but again, just level setting before we get into this of, why is this so important? How many people really are involved in mobile conversations and active in social data? So this is just saying that about 70% of people own a smartphone. That's obviously going to increase over time. You certainly see on the bottom that penetration in the US of that growing over the last few years. And I think also really important for a healthcare conversation is that sometimes people say to me, well, yeah, that's great data and we see that growing and people are active in social, but are people who are older actually doing that? And the answer is yes, and that's only growing over time as well. So just kind of level setting on some early data here. But while that's important, the way we really look at the world is also where along the journey are they looking at that data and how are they interacting. So this is to say that 31% of people are actually researching symptoms. To me, that actually seems a bit low. I've never actually felt something where I didn't go ahead and research something, but it really just shows that sometimes we're in our own world, right, and thinking about how people do that. But then these percentages jump up right after they've actually consulted a doctor, actually going to the internet or talking with people and seeing what they're learning about, right? So we know just how prevalent this is. And I love a quote like this, where you see that someone's experiencing something, immediately goes to a source. So this is not new information for any of us, but the way that we need to interpret this is to really use this type of conversation to know where people are going, to make sure that we're looking at the right data. So it goes back to that initial point of there's so much data out there, but plenty of studies are actually narrowing in and saying we can't use all of the data. What are the most critical sources to go a bit deeper on those sources, and using conversation to help us identify what are those really important places to drill into. So I'm going to bring up Shannon here. We're going to take you through two case studies that use two very different methodologies. So just kind of bear with us as we go back and forth a little bit here.
Thank you, Emily. So yeah, so a lot of the morning and into some of the sessions late morning, we've been talking a lot about why is this important, right? So you wouldn't be here if innovation wasn't something that was on your mind, figuring out how to use technology specific to the healthcare space. All of these things, I think in theory, we all get on board with. Yes, we want to understand people's emotions. Yes, we know there's all these regulations, but how do we actually go about doing some of this? And so these two case studies that we're going to cover today, and I'm going to cover the first one that puts us in more of a traditional sort of asking the patient for information, and then Emily's going to cover one that talks about how you can go and just listen to some of the things that patients are saying outside of where we go and proactively ask them for more of a traditional research kind of situation. So that's what we're going to share with you, just to give you a little bit of perspective for where we're headed. So I think everybody recognizes the situation with how risk averse some companies can be when they think about using innovative approaches or technology, or even something as simple as using mobile. I think Lisa said this morning, you know, mobile's been here for a really long time. It's not something that's necessarily new or different. And I agree 100% with that. A lot of times people, though, think that innovation means, oh, well, how can I just go use like this new piece of technology? And maybe it can be, but a lot of times mobile doesn't make sense, right? So being on the vendor side my entire career, I've had clients come to me and say, oh, I need to understand what this mobile thing is all about. Everybody's talking mobile, mobile, mobile. What do we need to do with it? And a lot of times the objectives that we have as we're looking at our patients or wanting to understand sort of a day in the life of our patients, you know, sometimes mobile may make sense, but sometimes it really may not make sense, right? So, you know, my biggest piece of advice frequently has been, look, let's not do mobile just for the sake of doing mobile. Let's do mobile when it makes sense. When mobile first came out, everybody thought, ooh, this is great. We're going to get this in-the-moment research. You know, ooh, I'm going to send a sales rep in. They're going to talk to the doc. They're going to walk out, and I can ping the doc and be like, hey, what were the top 3 messages that he told you about? Or, hey, you just saw a patient, and they asked you about this brand. Did you prescribe it? Did you not? Why? And while all those were wonderful hopes and dreams, when you actually go and try to do mobile research with physicians and you look at the timestamp on when they actually complete the survey, even if it is on their mobile device, it's at 11:30 p.m. at night sitting on their couch. So mobile can make sense in a lot of places, but don't do mobile just for the sake of doing mobile. Make sure that you have technology available, given the heavy prevalence that we all know exists of all these different types of devices. So if you're asking for information, make sure it's more of like a device agnostic type thing, so they can do it on their iPad or some of these traditional measures. But don't do mobile just for the sake of doing mobile. But sometimes mobile can actually really save you. And the case study we're going to talk about today is we were in a situation where we had a really large global segmentation. Of course, we had recommended they do this big, huge qual up front to really get at some of those emotional drivers and unmet needs, because figuring out sort of changes to the existing product or developing new products is a really big deal for this particular client. No, we can't do qual. We're just going to do quant. And then about a week and a half before we were ready to sort of finalize the survey design and launch into quant, it's, oh, no, we really want qual. We need some qual. And so we found ourselves in a really tight time frame situation. Now, in an ideal world, we might have gone out and done some traditional ethnography, followed these people around, understand kind of what their life is like, how it related to whatever condition they may have. That was not an option for us. We had a week and a half. It was global. We might then bring them into a facility, put a bunch of pictures in front of them and say, oh, well, when you think about your particular condition, which one of these resonates with you and why, and really ask a lot of questions and explore on that. Again, we had a week and a half. That was also not an issue, not something that we could do. So what we thought is, what could we do with mobile to sort of get us kind of there, right? So we were limited to English-speaking countries only. Again, we had like really less than a week and a half to get all of this done. So we don't have huge sample sizes here. I'm a quant girl, so I just have to give that caveat. But we still got great information with what we were able to go out and do. We pre-recruited people to come in. They had their phone. We gave them some very specific instructions, and this particular category was contact lens. We said 3 times a day, we want you to, as you're thinking about your contacts, or if you find yourself in a situation where your contacts are reminding you, whether it's you're happy with them, you're bothered by them, whatever, take a picture of wherever it is or what you're doing, and then upload them. We want a minimum of 3 pictures. At the end of the day, and then they answered 6 really short questions on their mobile phone. How were they feeling at the time they took the picture? What was going on in their minds? Some really sort of rich, open-ended kind of information. Now, we allowed them to do this for 4 days. And even though those sample sizes were small, 6, 9, 10, we got over 330 pictures back in a very short amount of time that provided some very, very rich insights. Not only as we started thinking about developing attributes for the segmentation questionnaire, but also, things that we were able to give over later to the ad agency as they started thinking about, look, when people start associating these types of emotions with their contact lenses at different parts of their day or in different parts of their lives, here's the kind of images that resonate very specifically to each of these people. Again, how we were able to do that at the end of the day, getting that questionnaire ready to go and out the door, which is why the timing was so tight to begin with on a global basis, was the primary motivator. But they had this huge library of images. I think we probably had 100 of younger girls who took selfies of themselves after they put their contacts in, and we had to, after the first day, go, no, we don't want selfies of you taking pictures of your contacts. But once we got that sort of clear, we had this wealth of readily available information, something we couldn't have gotten any other way in the very short amount of time frame that we had available to us. And we were also able to then go back and look and see throughout the course of the day for the 4 days that we had them for. And again, this is one particular case study. You could, pre-recruit them to do it for a longer amount of time, but you could kind of follow them along and see, when they found themselves in a certain situation. I want to go to the Y, I want to go swimming. Oh, I got to take my contacts out. I'm taking a picture of the pool. See, I feel frustrated right now. We were able to quickly capture that in a quick mobile survey and provide a lot of guidance and insight for our final survey development. So that's an example of the asking for a traditional type of information. And now Emily's going to give us a quick case study on the listening to information that's available.
So just have a few minutes here, so I'm going to talk really, really quickly. I think if you walk away with one thing, know that the technology when it comes to bringing in social data has really advanced over the last several years. I personally have been doing this for 10 years, so the tools have come a long way, but they can't do everything. So if you're talking to a vendor or talking to the tools themselves and they try to make it sound so amazing that you're going to see this dashboard and see all your data, yeah, the dashboard may look nice, but it might not be able to tell you anything and give you an insight that you can really hang your hat on and make an actual decision. So the way that we're using technology is to be smart in bringing in the right data, but you still need smart analysts who are actually going to read through the content and analyze it through a really smart framework. So it's all about the research design and how you ultimately want to report back on that data, okay? Again, just to level set really quickly, why is social data so important for healthcare? We get this question all the time. One is anonymity. So I work in other areas outside of healthcare, and there's a lot of sources that have really gone the way of the dinosaurs, where message boards and forums aren't as relevant anymore because people have chosen to take that to other platforms. Not so for healthcare, because people aren't going to necessarily talk about very sensitive subjects in a very public place, right? So that anonymity leads to a lot of amazing conversations that need to happen. The exchange factor. So yeah, I can meet someone probably 2 feet away from me who may also have a cold or a flu, where I could talk about my symptoms and how you might treat that. Not so if you're talking about a condition where you don't have that many people around you who are experiencing the same thing. All of a sudden you find a forum where you can meet other people and you just unleash all this information and, dare I say, almost overshare at times, right? A tremendous amount of personal information because of that space. And because all of this data is happening, can lead to just a very efficient way of actually analyzing data and processing it and reporting on it. This is a blinded study, of course, so I can only say so much. So let me just tell you a little bit of details on a very specific condition where a client wanted to understand not only their medication, but also the condition in general. So clearly that means you need to create a query or a complex set of keywords where you're bringing in data not only about that drug treatment, but the full competitive set, and also more general terms around the condition itself. You really don't want to bias the data that you're pulling in. So we can see all of our challenges here. I'm going to talk to that quickly. You really want to get to the last slide here. The approach was to go back 10 months of data. I don't suggest you go back more than that at times. Clearly the world changes very quickly. You would really only want to use more data. Let's say if you were trying to compare the launch of a drug and there was a very specific reason why you were choosing a time frame. Otherwise, better to focus on some earlier data. And then actually the sources here, we selected only a handful of sources sources where we knew people were very active talking about this condition. Goes back to the idea of the right data, not just about all of the data. So there's content collection. Very important to make sure, we want to be very clear, never pulling any sources where people need to create a login. We're not saying that we're patients if we're not, right? So certainly some sources are going to fall into that category and you can't use that data. So we take a lot of care in what data we're using. So having a deep exploration, I have 50 seconds here. This is kind of dumbing down the analytical process, but you need to set up a code frame in terms of how you're going to analyze this data. So if we take the disorder, and now we're thinking about therapy stages, going from pre-diagnosis all the way through treatment, you can look at a message and actually indicate where along the path is this person, what are the actual topics driving that discussion, the treatment and products, who are those trusted advisors. That way you can cross-tab all of that analysis, and ultimately, this is what we can produce. So this is completely scrubbed and completely blinded, but this is probably more detailed than you've seen if you've looked at sentiment or certainly just discussion volume trended over time. What this is saying in that in this particular category, people go from a moment of clarity to confusion. There's trust, there's disbelief, there's confidence, and there's uncertainty. And this is not the case for every single category. This was very unique to the situation of that patients were experiencing. So if you can go through this for a moment, it's all about recognizing that there's something wrong, hearing a very scary diagnosis, actually reacting to that, going to sources, and in a full study, actually, of course, we're outlining what are those sources, who are those trusted advisors, all the way through gaining some clarity. Then you're starting to get into this trust situation where you may actually go forward with a treatment plan. You're seeking some answers. You may go into disbelief. So ultimately, we're out of time here, but I really wanted to show you that when you analyze a category, this is what you're trying to get. You want to understand the path that people are going on in that journey, and the whole purpose in terms of what this client was looking for was what could they create that could help people along this path. So if you know what those critical points are and what treatment options they're considering, and then having to essentially go back to the beginning when things aren't working so well, what could you create as that source of information or help them along this path? And all those different touch points allow you to develop far better content. So just a quick example, but come talk if you want any more details on this.
Thank you so much, Emily and Shannon. We have time for one brief question. Somebody have a quick question out there? Yes, we do have one right over here.
So I'm curious, I'm sure a lot of us, and certainly we are, playing with, scraping social media and trying to figure out, it's got lots of advantages to it. Your method, as you've outlined it here, looks like a lot of smart, warm body time to get this data into a usable form. And I know one of the attractions I think the clients come into the interest in social media having is, oh, it's going to be inexpensive. I don't discern this as an inexpensive. It looks very fascinating, but am I fair in
You're totally fair. I think it is trivializing the value of social data, what you can get out of it, if you think of it as only being a 5K study, and sometimes it can be. We do plenty of those, by the way. Sometimes it really is a quick and dirty, excuse the expression, but we can easily access data. You're right, you can target data with very specific keywords. You can narrow in on that, and you can give some pre-reporting. We actually do a lot of that before quant studies and qual, because sometimes you want to figure out what do you already know, so you don't have to maybe ask those things in survey, or you can learn some things that can make the qual sessions even better. So I refer to that as using social data for your homework, right? Instead of people use the term desktop research, which I get, but also drives me a little crazy because you can be far more efficient in your use of targeting the right data than Googling. That's like strange to me. So those can be some very focused studies that then need more data to follow up and answer those questions. You're not going to answer your critical objectives with a 5 to 10K study, right? But you can use social data as that pre-wave for other things. Is that helpful? Yeah, no, it does.
It did take a lot of smart people a good amount of time, but it was fabulous looking. So.
Yeah, cool, thanks.
Great, thank you so much, Emily and Shannon.
Thank you.